Hello, I am Dr. Preeti Nanda, a practicing anesthesiologist consultant in Dombivli. Being an anesthesiologist has been a very fulfilling experience, as it is just not the anesthesia that we give. We are involved with a lot of other things also. Uh, of lately, we have been into this ACLS, BLS, and COLS training, and I'm a ACLS instructor also. So it is also a very rich experience when we are training people for life-saving skills, and we are into pain management, intensive care, and whatever branch of emergency medicine is there, anesthesiologists are involved there. So it's a very beautiful branch, and I'm very lucky that I'm an anesthesiologist. Working in a rural setting becomes a bit challenging when the equipment or when the care like in the sense of intensive care or tertiary care or cath lab, these things are not available. uh, but at this Search Foundation, they have a very beautiful OT, a very well trained staff, and definitely the TSF surgeons are the best. So it becomes a very good team when we are working here, and the limitations are not so much, but still we are very careful in selecting the patients, as whoever will require a tertiary care, we try to not keep them here, but the TSF people do it in a higher center. Anesthesia as a branch has really grown well. Initially, the surgeries were done by like just putting some gag in the mouth so that the patient wouldn't shout, or apply ice. And this is not a joke, they actually did this. It was very limited surgeries were done, and the scope of growing for the surgery was very low. But once anesthesia was properly discovered, and once anesthesia started growing and getting more and more sophisticated, more and more sophisticated surgeries are being done, more and more high risk patients are being operated without any complications. When we go for surgery, patients are not at all worried, because they know that okay, now anesthesia is just to alleviate pain, and they will not get any pain during surgery. It is not that okay, I'm scared of anesthesia and I will be alive up to the end of this or not. So anesthesia has a huge role in the growth of surgery, and both are growing simultaneously, because we cannot say that if surgery is not to be done, we cannot give anesthesia, and if anesthesia is not given, surgeries cannot be done. So it is a like both of them go hand in hand. It is quite emotionally being upset that when we see these patients who are suffering from spine problems, they are not able to walk, they are not able to do their routine work, and they are not able to, sometimes if they have a problem higher up in the cervical spine, they are not even able to lift their hands. And the saddest part is that in these rural areas, the affordability is poor, very low. So the patients are poor, and they are not able to afford these surgeries. Because if you go to a tertiary setup and get it done, nothing short of 2 to 3 lakh rupees will be required for this surgery. So these are very poor kind of people, and Dr. Bang and Dr. Bhojraj are doing a fantastic job by bringing these surgeries to the doorstep of these people. And emotionally, yes, it is hurting that like there is a big divide between a rural and urban area in the healthcare setup. Um, but I think these foundations, these kind of people who are doing great job and trying to bridge this gap by bringing people like us in the urban area to this rural area and making this place fit enough to do lot of high risk work. That I have come with the TSF in Gadchiroli, and it's actually really beautiful. I'll be thankful to TSF people that they brought me here, and it was wonderful because we have seen these poor patients suffering from quite a high level of spinal problems, and once these are done on table, they are able to move their limbs and properly. And then when we ask them that there is no pain, it's really, really satisfying that we have done something well for the society. TSF is a voluntary organization which is being run by Dr. Bojraj and his team since many years, and they are doing a fabulous job by bringing the spine surgeries to the doorstep of the people. Not even here in Gadchiroli, but many other places, and they can give the labor and the time they are giving, and they will require a lot of support uh, from the society because they are trying to give it to the society. I think people from the society should volunteer more often to come here and work here as volunteers, as we have volunteered. And definitely, if someone is wanting to donate, these are the best people to donate because the help is actually reaching the patients. Thank you.